Imagine a sudden, unexpected event that leaves someone vulnerable, especially if it happens without warning. Knowing when to act swiftly can make all the difference, particularly if there is an injury involved. You should call 911 for a seizure injury immediately if the person is severely hurt, has difficulty breathing, or if the seizure happens in water. Urgent medical attention is also needed if the person does not regain consciousness after the seizure, or if it is there for seizure ever. These situations requiring professional medical evaluation without delay. The core reason for calling emergency services in these specific scenarios is to prevent further complications or life-threatening situations. Injuries such as a head trauma, severe cuts, or bone fractures requiring immediate assessment and intervention. Similarly, respiratory distress or prolonged unconsciousness after a seizure can indicate a more serious underlying issue that needs expert care quickly. To help you make the right call, observe the person carefully during and after the seizure. Look for obvious signs of injury like heavy bleeding, a twisted limb, or a visible head wound. Check their breathing patterns, noting if it is shallow, labored, or completely stopped for an extended period. If the seizure duration is longer than 5 minutes, that is another critical indicator to call for help, even without an obvious injury. Many people think all seizures requiring 911, but often, basic first aid is enough. However, when an injury is present, a secondary concern arises. For instance, a fall during a seizure might lead to a subdural hematoma, which is bleeding on the brain's surface, sometimes without external signs. Emergency medical technicians, or EMTs, are trained to recognize these less obvious but potentially dangerous injuries and can transport the individual safely to a hospital for further diagnostics. Prioritizing safety and quick, informed action in the event of a seizure-related injury ensures that the person receives timely and appropriate care. Recognizing these critical signs and knowing when to escalate to emergency services can help manage potential complications effectively, promoting better recovery and peace of mind.